Toniann Richard is the CEO of HCC Network, a group of 6 community health centers in Missouri. Toniann, good morning. How are you?
Good. How are you?
Good.
Thanks
I've been
for having me.
excited to talk to you because we've been hearing about the big, beautiful bill and the cuts, but I want to talk about how it's affecting real people like me and you. So this bill was signed into law 2 weeks ago. It's projected to cost rural hospitals nationwide more than $66 billion in Medicaid funding. That's just in the next 10 years. That's one estimate. So Toniann, give us a sense of what these funding cuts will mean for the 6 hospitals in Missouri that you oversee.
Sure. So there's a lot of right now 50% of hospitals across the country are already working on negative margins. And so when you put a strain on the payer system, such as Medicaid, you're going to see a lot of changes. Number one, leaders are going to have to decide how to fund that loss. And so is that a reduction of capital improvements, equipment changes, equipment upgrades, those types of things, additional services and specialties. And so we're going to see that. There's also obviously the concern of more people becoming uninsured, delaying access to care, and ending up in the emergency room where those bills are less likely to get paid. So the stress of the situation is real. And I think right now a lot of leaders are coming together and trying to figure out how we can coordinate and collaborate and come up with some solutions that are best for each individual's state and area.
And look, the number of Americans on Medicaid, it's huge. According to the latest federal data, it shows 71 million Americans are on Medicaid. 1.1 million are just in your state of Missouri, where your health centers are located. Talk to us about how this law will likely filter down to the 1.1 million patients in Missouri. And that's just those are just the ones on Medicaid.
Right. So, I mentioned the 50% of all rural hospitals across the country are operating in negative margins. Missouri is going to be one of the largest hit states with this Medicaid reduction. We're looking at a 29% reduction in those covered. And so that is extremely significant for our state, putting 1/3 of our hospitals at risk. And so trying to find ways where we can make sure that patients are educated on their care, make sure that they understand where to get the information, stay up on it, the work requirements that will be implemented, making sure that they are compliant on that. So we don't have people being removed from the Medicaid system due to a situation like not being compliant in the program, and then just figuring out how to divert people to the right place and the right time to seek the care that they need.
That's quite an overhaul. That's an overwhelming task, and we're only talking about those on Medicaid. What will this mean for patients who are not on Medicaid?
Right, so it'll be compounded. More people will be seeking care in safety net clinics. Safety net clinics will be responsible for raising additional dollars to offset that loss of uncompensated care. Right now, uninsured rates in rural communities is already high. So when you look at adding 1/3 of your population to that's pretty overwhelming. The reality is, I heard somebody, a physician earlier, say policy does not drive care, and there's no truer words to that. People need to seek access, and they need to be able to get care. And just because they don't have insurance doesn't mean that they won't still need access to services. And so figuring out how to get people to places that they can be seen is already a challenge in rural communities. And if you close even just 1 or 2 hospitals that have clinics associated with them, or just hospitals on their own, you're going to reduce the number of places that people can go.
I have to say, Toniann, as I talk to you, this seems like it could become a dire situation really fast. The law does include a $50 billion rural health fund for rural hospitals. It's going to be distributed over the next 5 years, as you know. Missouri Senator Josh Hawley, just this week, introduced a bill that would double that amount. But you say the current funding level is not enough. Tell me what you and the other hospitals across the country, not just in Missouri, will need from the government to be able to support its patients at the level of care that they're used to receiving.
Right. So, and while we appreciate the transformation fund and what is the attempts at adding dollars to that, definitely appreciate it. One of the concerns is that it's really not a provider relief fund, and so the dollars that are being put into this fund, as it relates to provider payments, are limited. We would love to see more flexibility with that. The ability for the states actually have to get their plans submitted in the next 5 to 6 months to be even be approved, and then CMS has a lot of authority over that. We would love to see those payments get directed to rural providers who are really going to need it for relief services, so they can maintain their workforce and continue to take care of people in their community.
We're talking about providers. I also want to ask you about the patients. What message do you have for them? What can they be doing to best prepare for these cuts that we're anticipating? And of course, eliminated services moving forward.
Sure. So it's a great question. Even being in a leadership position in healthcare right now, the information is so overwhelming. The timelines can be confusing, especially as they change and update. And so we're trying to be so respectful of patients that are finding themselves in a panic and being very concerned about how to take care of themselves and their families. And so right now, what we're doing is trying to direct people to places where they can get accurate information. We're trying to make sure that we are putting out information that is in ways that everybody can understand it. It's not as confusing, and just reassuring people that listen, as soon as we know things, we're working on a plan to take care of people. We want to be here to serve our communities. Hospitals are and healthcare organizations are the economic engines behind a lot of rural communities, along with education and municipalities. And so we want to take care of people. We are very concerned about the most vulnerable in our communities, and we will be here as best we can to continue to take care of people where they are, and just encouraging them to continue to come ask us when they have questions.
Yeah, I think that's an important message for patients. I really, again, appreciate you coming on and, being the face of what so many Americans could face because of this. Toniann Richard, please keep us updated. I appreciate your time and, of course, your insight. Thank you.